5 foods that actually help blood sugar after 60. Good evening. If you've ever felt that heavy, foggy crash after a meal, if you've been told by your doctor that your blood sugar numbers are creeping up, or if you're already managing type 2 diabetes and just trying to make better choices day to day, I want you to stay with me for the next few minutes because what we're going to talk about tonight could genuinely change how you feel, not just on a lab report, but in your everyday energy and mood. Blood sugar management becomes more important and honestly more complicated as we get older. Our bodies process carbohydrates differently than they did at 30 or 40. Insulin sensitivity tends to decline with age, meaning the same plate of food that barely affected your blood sugar decades ago might cause a much bigger spike today. This isn't a personal failing. It's a normal part of aging, and the encouraging part is that food choices remain one of the most powerful tools we have to manage it, often working alongside whatever your doctor has already prescribed. Before we go further, I want to be completely transparent with you. I am not a doctor, a dietitian, or a medical professional, and nothing in this video is meant to replace the advice of your own healthcare provider. Diabetes and blood sugar management are deeply personal. What works well for one person may not be appropriate for another, especially if you're on medication that affects blood sugar, like insulin or sulfonylureas, where certain dietary changes need to be made carefully and in coordination with your doctor. Please treat this video as a starting point for a conversation with your physician or a registered dietitian, not as a substitute for one. With that said, let's talk about real food, real research, and real practical steps you can start taking this week. Before we count down, I'd love to hear from you. Drop a comment and let me know. Are you currently managing prediabetes, type 2 diabetes, or are you simply trying to be more mindful of your blood sugar as you get older? I read every comment, and it genuinely shapes what I cover in future videos. We're counting down from 5 to 1. 5 foods and food strategies that have real evidence behind them for supporting healthier blood sugar levels. Number 5. Leafy greens and non-starchy vegetables. Let's start with something simple, affordable, and incredibly well supported by research. Leafy greens like spinach, kale, collard greens, and other non-starchy vegetables such as broccoli, cauliflower, zucchini, and bell peppers. Here's why these matter so much for blood sugar specifically. Leafy greens and non-starchy vegetables are very low in carbohydrates relative to their volume, meaning you can eat a generous portion without significantly raising your blood sugar. But it's not just about what they don't contain, it's also about what they do contain. These vegetables are rich in fiber, and fiber plays a critical role in slowing the absorption of sugar into your bloodstream. When you eat fiber alongside carbohydrates, or even before them, it creates a kind of physical barrier in your digestive system that slows down how quickly glucose enters your blood, leading to a more gradual rise rather than a sharp spike. There's also growing research interest in something called meal sequencing, essentially the order in which you eat the components of your meal. Several studies, including ones from researchers in Japan and the United States, have found that eating vegetables and protein before carbohydrates in the same meal can meaningfully reduce the blood sugar spike that follows compared to eating carbohydrates first. This is a fascinating, low-effort strategy. You don't have to eliminate the rice, the bread, or the pasta entirely. You simply eat your salad or vegetables first, then your protein, and save the starchy portion for last. Leafy greens are also rich in magnesium, a mineral that plays a direct role in how your body uses insulin. Research has linked magnesium deficiency to increased insulin resistance, and many older adults are mildly deficient in magnesium without realizing it, partly due to reduced absorption with age, and partly due to certain medications that deplete magnesium over time. Practically speaking, aim to fill at least half your plate with non-starchy vegetables at most meals. A large spinach salad with olive oil and vinegar before dinner, a side of roasted broccoli, or sautéed greens with garlic are all simple, inexpensive ways to bring more of this into your routine. And remember the sequencing tip: vegetables and protein first, starches last. Number 4. Fatty fish and healthy fats. Moving up the list, we have fatty fish, salmon, sardines, mackerel, and trout, along with other sources of healthy fats like olive oil, avocado, and nuts. You might wonder what fat has to do with blood sugar, since fat itself doesn't directly raise glucose levels the way carbohydrates do. But the relationship is more nuanced and important than it first appears. Healthy fats, when eaten alongside carbohydrates, slow gastric emptying. Essentially, they slow down how quickly food leaves your stomach and enters your small intestine, where sugar gets absorbed into the bloodstream. This means a meal that includes healthy fat tends to produce a gentler, more gradual blood sugar response compared to the same carbohydrates eaten alone. Beyond that immediate effect, omega-3 fatty acids found in fatty fish have been studied for their broader role in reducing chronic inflammation, which is increasingly recognized as a contributing factor to insulin resistance. Chronic low-grade inflammation can interfere with how effectively your cells respond to insulin, making it harder for glucose to move out of the bloodstream and into your cells where it's actually used for energy. Several studies have found associations between regular omega-3 intake and improved markers of insulin sensitivity, though researchers are careful to note that fish should be seen as one part of an overall dietary pattern rather than a standalone fix. Olive oil deserves a specific mention here too. The Mediterranean diet, which features olive oil prominently, has one of the largest and most consistent bodies of research behind it when it comes to blood sugar management and cardiovascular health in older adults. Multiple long-term studies have found that people following Mediterranean-style eating patterns, rich in olive oil, vegetables, fish, and whole grains, tend to have better long-term blood sugar control and lower rates of developing type 2 diabetes compared to those following typical Western dietary patterns. A practical way to bring this in? Aim for fatty fish 2 to 3 times per week. Use olive oil as your primary cooking fat instead of butter or vegetable oils, and include a small handful of nuts like almonds or walnuts as a snack instead of crackers or chips. These swaps are simple, but research suggests they add up to meaningful differences over months and years. Number 3, cinnamon with an honest caveat. This one tends to generate a lot of excitement online, and I want to address it directly because I think it deserves both genuine credit and an honest dose of caution. Cinnamon has been studied specifically for its potential effects on blood sugar, and the research is more substantial than many trendy food claims you'll come across. Some studies have found that cinnamon may improve insulin sensitivity and modestly lower fasting blood sugar levels in people with type 2 diabetes. The proposed mechanism involves compounds in cinnamon that may mimic insulin's effects on cells or enhance the activity of insulin receptors, helping glucose move into cells more efficiently. However, and this is important, the research on cinnamon is genuinely mixed. Some studies show a meaningful reduction in fasting blood sugar, while others show little to no significant effect. The size of the benefit, when it is found, also tends to be modest rather than dramatic, and results vary depending on the type of cinnamon used, the dose, and the population studied. There are also 2 main types of cinnamon, cassia and Ceylon. And cassia cinnamon, the more common and less expensive variety found in most grocery stores, contains higher levels of a compound called coumarin, which in large amounts over time has been associated with liver concerns. Ceylon cinnamon contains much less coumarin and is generally considered the safer choice if you plan to consume it regularly in larger amounts. My honest take? Cinnamon is not a miracle solution, and you shouldn't expect it to meaningfully offset a diet that's otherwise high in refined carbohydrates and sugar. But as a low-risk, low-cost addition, stirred into oatmeal, coffee, or yogurt, it's a reasonable inclusion with some genuine science behind it, as long as you're using it in normal culinary amounts, and ideally choosing Ceylon cinnamon if you're using it daily over the long term. If you're on blood sugar medication, it's still worth mentioning to your doctor, simply because any compound that affects insulin sensitivity, even mildly, is worth knowing about in the context of your specific treatment plan. Number 2, nuts and seeds as a daily habit. Nuts and seeds deserve their own dedicated spot on this list, separate from the fats category, because the research behind them specifically for blood sugar management is substantial and consistent. Almonds, walnuts, pistachios, chia seeds, and flaxseed all share a combination of qualities that make them particularly useful for blood sugar control. They're relatively low in carbohydrates, high in fiber, contain healthy fats, and provide plant-based protein, a combination that together produces a minimal impact on blood sugar while also helping you feel satisfied and full. Several clinical studies have looked specifically at almond consumption and blood sugar outcomes. Research has found that incorporating a modest daily serving of almonds, roughly a small handful, was associated with improved fasting blood sugar levels and better markers of long-term blood sugar control in people with type 2 diabetes when compared to control groups. Walnuts have shown similar associations in research, alongside their well-documented benefits for heart health, which matters enormously for older adults managing diabetes, since cardiovascular disease risk is significantly elevated in this population. Chia seeds and flaxseed bring an additional benefit worth mentioning. They're exceptionally high in soluble fiber, which forms a gel-like substance in the digestive tract that further slows carbohydrate absorption. A tablespoon or two stirred into yogurt, oatmeal, or a smoothie is an easy, low-effort way to add meaningful fiber to your day. The practical application here is simple. Instead of reaching for crackers, chips, or sugary snacks between meals, reach for a small handful of nuts or seeds instead. Portion does matter, since nuts are calorie-dense. Roughly a quarter cup is a reasonable daily serving for most people, but within that portion, you're getting a snack that research consistently associates with steadier blood sugar and improved long-term metabolic markers. And now, number 1, the habit I believe matters most of all: vinegar before meals and movement after them. I'm combining two related strategies here because together they represent what I consider the single most actionable, evidence-supported approach for managing post-meal blood sugar spikes, which for many people managing diabetes or prediabetes is the single biggest daily challenge. Let's start with vinegar. Several clinical studies have examined the effect of consuming a small amount of vinegar, typically 1 to 2 tablespoons diluted in water, before a carbohydrate-containing meal. The proposed mechanism involves acetic acid, the primary active compound in vinegar, which appears to slow the breakdown of starches in the digestive tract and may also improve insulin sensitivity in the hours following a meal. Multiple studies have found that this simple practice can reduce the post-meal blood sugar spike by a meaningful margin compared to eating the same meal without vinegar. A practical way to use this: mix 1 to 2 tablespoons of apple cider vinegar into a large glass of water and drink it about 15 to 20 minutes before a carbohydrate-heavy meal. It's important to dilute it properly, since undiluted vinegar can irritate the throat and esophagus, and to be cautious if you have any history of acid reflux or digestive sensitivity, in which case this strategy may not be appropriate for you. Another reason to discuss it with your doctor first. Now let's talk about movement, because the research here may be even more compelling. A short walk after eating, even just 10 to 15 minutes, has been shown in multiple studies to significantly reduce post-meal blood sugar spikes. The mechanism is fairly intuitive. When your muscles are active, they pull glucose out of the bloodstream to use as fuel, independent of insulin. This means that even a gentle walk can help lower blood sugar through a completely separate pathway from what your medication or insulin is doing, working alongside your body's natural processes rather than relying on them alone. Research comparing post-meal walking to remaining seated has consistently found lower blood sugar readings in the walking group, often within just 15 to 30 minutes of finishing the meal. This is a particularly encouraging finding for older adults because it doesn't require intense exercise or a gym membership. A slow, comfortable walk around the block, around the house, or even in place if mobility is limited, appears to provide a real, measurable benefit. Combining these two strategies, a small amount of diluted vinegar before a carbohydrate-containing meal and a short walk afterward, represents, in my view, one of the most practical, low-cost, and well-supported approaches available for someone trying to manage blood sugar day to day. Neither requires special equipment, expensive ingredients, or dramatic lifestyle changes. They simply require building two small habits into your daily routine. Let's bring this all together with a simple example of what a day might look like using these 5 strategies. Imagine breakfast starts with a small glass of diluted vinegar water, followed by Greek yogurt topped with a tablespoon of chia seeds and a light dusting of Ceylon cinnamon. For lunch, a large salad of leafy greens with grilled salmon and a drizzle of olive oil, eaten before any starchy side, followed by a short 10-minute walk afterward. For an afternoon snack, a small handful of almonds instead of crackers. And for dinner, non-starchy vegetables and protein eaten first, with a modest portion of rice or potatoes saved for last, again followed by a brief walk. None of this requires perfection, eliminating entire food groups, or expensive specialty products. It's simply a thoughtful sequencing and combination of foods that have real, consistent research behind them. I also want to take a moment to address something that often gets overlooked in conversations like this. Consistency matters far more than perfection. You don't need to apply all 5 of these strategies flawlessly every single day to see benefit. Even incorporating 2 or 3 of them most days of the week over the course of weeks and months tends to produce meaningful improvements in how people feel and often in the numbers their doctor tracks at follow-up visits. Sustainable habits built gradually tend to outperform dramatic, short-lived overhauls that are difficult to maintain. It's also worth saying clearly, blood sugar management is not just about food. Sleep quality, stress levels, medication adherence, and regular movement throughout the day all play significant roles, and none of these 5 food strategies are meant to replace medical treatment, medication, or regular monitoring as recommended by your doctor. Think of them instead as supportive habits that work alongside whatever care plan you and your physician have already established. So, to recap everything we've covered tonight, fill half your plate with leafy greens and non-starchy vegetables and eat them before your starches. Include fatty fish and healthy fats like olive oil regularly to slow digestion and support insulin sensitivity. Consider a modest amount of Ceylon cinnamon as a low-risk addition while keeping expectations realistic. Make nuts and seeds your go-to snack instead of refined carbohydrates. And most importantly, try a small amount of diluted vinegar before carbohydrate-heavy meals, followed by a short walk afterward to blunt the post-meal blood sugar spike that tends to cause the most trouble for so many people. If this video was helpful, I'd genuinely appreciate it if you'd subscribe. I share content like this regularly, focused on real, evidence-based strategies for healthy aging, without exaggerated claims or miracle promises. Managing blood sugar after 60 isn't about chasing perfection. It's about building small, sustainable habits that add up over time, supported by real research and, ideally, your own healthcare team. And before you go, let me know in the comments, which of these 5 strategies are you already using, and which one are you going to try first? I read every comment, and your experiences genuinely help shape what I cover in future videos. Take care of yourself, and I'll see you in the next one.